Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to make a video for anybody who wants to start hormone therapy, whether it's feminizing or masculinizing hormone therapy, and you are hesitating because you're concerned about certain changes that the hormones can bring up that you really do not want to have. And this video is for anybody who is, identifying anywhere on the spectrum, whether you identify as trans-binary, meaning you identify as trans male or trans female, or non-binary, or any other gender identities in the middle of a spectrum. Basically, this is a video for anybody who's interested in hormone therapy in order to alleviate your gender dysphoria, whether it is a hormone therapy full regimen, or whether it is partial regimen, or whether it's microdosing, either feminizing or masculinizing hormones. And you are afraid of certain changes that hormones may bring. So for example, for masculinizing hormones, you may be afraid of early sign of male pattern baldness. You may be afraid of acne on your face. You may be afraid of, if you're just interested in microdosing and having very subtle changes, you may be afraid of facial hair or voice drop. For anybody who is doing feminizing hormone therapy, the same thing applies. You may be afraid of breast growth, while some of you really want the breast growth. You may be afraid of redistribution of the body fat. You may not really want to have such changes as softening of your skin, such changes as even decrease in your sexual libido to the point where you may have a difficulty maintaining staying erection, especially for those of you who are not interested in genital surgery and are very comfortable with your genitalia and are very sexually active. So what to do when you want to do hormone therapy, you want to engage in hormone therapy as part of your transition path, and there's certain things that hormone therapy can bring that you really do not want to have experience. And some of those could be also medical risks, right? Hormones, because what we're doing essentially is, instead of your body producing your natural hormone, we're sublimating your body with another hormone. So the result, of course, there's medical risks, not for everybody, but for some people there could be potential medical risks. So here you are in the situation, you want to start hormones, but there's some changes that you just don't really want to experience. What to do about that? And usually it is body changes. Usually a lot of times it's for those of you who want to microdose or have a very partial regimen just to get enough subtle changes that you're looking for. Well, I'm really saddened to tell you this, but there's going to be a trade-off. Transition in so many ways is not a straight ticket to a super comfort zone where you feel so good and so in alignment with yourself. It is for some people, but for most of the people, it is some form of a trade-off, only because transition in of itself is such a difficult undertaking and such an expensive undertaking and can be such a painful undertaking. As a result, this is not a walk in the park. And those of you who are watching this clearly know what I'm talking about. So, those of you who are watching who are on hormones know the trade-offs are there. So when I say trade-offs, it's important for you to sit down and to ask yourself, okay, I really want to take testosterone, and I really want to take testosterone for an outline for yourself of what reasons you want to take it, and hopefully alleviating the distress of gender dysphoria is going to be one of the primary reasons. And then write down on the next column, what are you afraid of if you were to take testosterone? And it could be any of the things I pointed out or some other things, and just put them down over here. And then ask yourself, can I go without taking testosterone? Can I perhaps modify my gender expression and gender role and feel more congruent and alleviate gender dysphoria, and therefore don't have to deal with the trade-off that I'm so afraid of? And if you can, then great. Then that's a great way to do things without really going into the medical transition, which is brings out all of these changes and brings out potential risks. Now, if you realize that, no, the gender dysphoria is severe, or that the changes that I desire, the potential benefits that testosterone will bring, are so greater that the trade-off what I'm afraid of is really, not really pairs up, then there's your answer. But the reality is that there's going to be trade-offs. The same thing with feminizing hormone. Trade-offs happen because, again, you're going to have changes that you may and may not want, and not everything is going to be exactly how you envisioned. For example, a lot of people really want to achieve very feminizing, softer features on estrogen and really achieve a desirable breast size. Well, the trade-off is that doesn't always happen. To achieve a larger breast size, I seldom see people be able to go beyond cup B. Same thing with the facial features. Sadly, because testosterone had such an effect on bone structure, even with feminizing hormones, while it will soften up a lot of features, a lot of this softer tissue around the bone structure is still going to remain. And so for a lot of people, feminizing hormone is not enough and facial feminization is needed. So there's all of these trade-offs are just part of reality. They're just part of transition. And this is again why I encourage people who are feeling doubt, uncertainty, still questioning their identity, not to rush into medical transition, but to spend time really trying to understand how much of this could potentially be just a gender exploration aspect or gender role confusion. And I'm not saying that because I want to gatekeep transition. All of you who know me personally know that if anything, I'm the first person to go against gatekeeping because I cannot stand it. And I respect your body autonomy. But I think it's also really important to understand what your needs are and to be very clear about expectations and to be very clear about what you may be getting and what you may be giving away. So, and once you have those expectations and if they're realistic, you can safely go into medical transition. And when those things come up that you did not want to get, at least you can look at them and say, I knew this was potential. It's too bad that this is happening to me. It's too bad that I fall in the category of people that did get early sign of hair loss. But at the same time, being on testosterone makes me feel amazing. It makes me feel more congruent. It makes me feel more like myself. And that's better than having full head of hair and feeling a lot of that inner dysphoria. So all of those things are really important. It's important to give yourself time to evaluate things, to think about them. But in terms of some of you, a lot of you actually asked me this question, how to deal when you don't want to get the changes, especially physical changes, that feminizing and masculinizing hormones bring. You know, there's not much you can do. It's one of the things where it just, you know, that phrase, bite the bullet. A lot of you who have gone through transition, who are on hormones, know exactly what I'm talking about. A lot of you had to deal with changes that came up that you did not want to get, that you wish you didn't get. At the same time, a lot of you do know that what you traded for, which is the lessening of the dysphoria, the more congruent feelings, the more feeling being authentic and in touch with yourself, far outweighs those things that tended to come up. And keep in mind, those things don't come up for everybody. So that's another thing, is that you don't know what you're going to get. When you're going on the hormones, it's a lot of times all about a lot of things, including your age, your health, and most importantly, how your body tends to metabolize hormone. So as a result, you don't really know how you're going to respond. While somebody over here may respond differently, you may get a completely different response. So keep that in mind as well. Comment below, let me know if you're about to start and you want to start hormones, what is your biggest fear, what's holding you back, how is this idea of analyzing your trade-off is affecting your decision making. If you are on hormones and been on hormones for a while, then you know this trade-off that I'm talking about, and you just know that that's just reality of transition. Unfortunately, this is not yet a solution that is a foolproof, that is just doesn't have any consequences or any kind of medical things arising out of it. This is a bad thing that we have going right now. A lot of people are able to alleviate a lot of their gender dysphoria, distress symptoms, and move on and just live very productive and happy, joyful lives. But as we know, it's not a perfect solution yet. And so that's the best that we have. So comment below, let me know. I'd love to read your comments, and I'll see you guys all next time. Bye.